Hi friends, I am Dr. Pratap Singh. I have done the Indian Forensic Medicine. In today's video, we will continue with cardiovascular poisons, the poisons which affect heart. In that, we will discuss about aconite. The roots of Aconitum napellus and Aconitum ferox are commonly poisoned, from which aconite is obtained. It is also known as monk's wood, blue rocket, Mita's hair, bish or beak. Aconite grows mainly in Himalayas. All varieties of plants are poisonous, least when young, more so when the seeds are ripened, and most when bloom they are poisonous. Most commonly, roots are the part of the plant which are most poisonous and mostly used for uh, get poisoned from the roots. The dry root is conical in shape, tapering at one end, shows scars or bases or broken rootlets, and is arched or shriveled with longitudinal wrinkles, which can be seen in the image. They are longitudinal wrinkles. It is usually 5 to 10 cm long, 1.5 to 2 cm thick, and at one end it is 1.5 to 2 cm thick. The external color is dark brown in color, and when freshly cut, the internal color is white. If it is taken cross section, the internal color is white but becomes pink on exposure to air. It is odorless but taste is sweet. Then it becomes acrid. When dried and soaked in oil, the root becomes black, heavy, hard, and brittle with strong offensive odor. So, if it is stored in the oil, it becomes hard and brittle and has an offensive odor. The root is commonly mistaken for horseradish. This is the root of horseradish, which is commonly mistaken for uh, aconite and mismatched, and aconite may be used for cooking purposes, leading to poisoning. The horseradish is cylindrical in shape, yellowish white in color, whitish internally. With taken cross section, it is whitish internally. It doesn't change the color, but aconite changes color to pinkish in color after it is cut open, but it doesn't change the color, and its taste is pungent. Horseradish taste is pungent. So if we take a difference, the color is brown, it is yellowish white horseradish. It is conical. The shape of the aconite is conical in shape, so it is tapering. So thicker at one end, it tapers at one end, but horseradish is cylindrical in shape. Cut surface, it turns pink in color, but horseradish doesn't change color when exposure to air. It is sweetish taste, it is pungent in taste, it is mainly used for cooking. Aconite is poisonous. Come to active principles. They are aconitin, pseudoaconitin, indacotinine, bicaconitin, picraconitin, aconine, misaconine, zesaconine. The roots and seeds are most potent, which consist the aconitin. Action: it is stimulates the sensory nervous system. The motor ganglia of heart are paralyzed and respiratory centers is slowed. Aconitin stimulates and then depresses the CNS system. Coming to absorption, it is absorbed from skin and mucous membrane. It is eliminated by all but roots, mainly in the urine. Coming to signs and symptoms, if leaves are held in hand or rubbed on the skin, it produces tingling and numbness. So also the root is held, it produces tingling and numbness in the hand. The odor of the plant has a narcotic effect. The pollen causes pain and swelling in the eyes. If the person consumes the root, it causes burning sensation from mouth to throat, mouth to stomach, and tingling and numbness in mouth, tongue, and pharynx. This is followed by salivation, nausea, vomiting, and diarrhea. Later, the mouth is dry and patient suffers from thirst and is unable to swallow. Tingling and numbness are then felt all over the body. There is headache, giddiness, pallor, profuse sweating, subnormal temperature, the limbs becomes weak, and the patient is unable to walk or stand. There is paresthesia, ataxia, and slurred speech occurs. There may be twisting of the muscles and darting pains, and cramps and convulsions may also occur. The pupils are alternately contract and dilate, which is called as hippus. So hippus is a one sign in which there is alternative contraction and dilatation and contraction of the pupils, which is typically seen in aconite poisoning, but it remains at later stages. The vision becomes dim and there may be diplopia. Hypotension, cardiac arrhythmias, tachycardia is seen in later stages. Then there is bradycardia later, and AV block also occurs. The mind usually remains clear throughout, but there may be some hallucination may be present. There is marked general muscular weakness, oppression in the chest, and death usually occurs from paralysis of heart or respiratory centers or both. Fetal dose is 1 gram of root, 2 to 5 mg of aconitine, 250 mg extract, or 10 to 30 ml of tincture of aconitine is fatal. Fetal period is 2 to 6 hours. Treatment gastric lavage mainly to remove unabsorbed poison with tannic acid, iodine, or charcoal. Multi-dose active charcoal is also helpful. Cataract to remove the poison. Atropine half to 1 mg is also useful, and symptomatic treatment is usually given. Postnasal appearance, they are not characteristics but are those of asphyxial signs. The mucosa of stomach and duodenum may show congestion and occasionally ecchymosis. Lungs, kidney, and brains are congested. Aconitine is extremely unstable and is destroyed by putrefaction. So, if the person has consumed aconitine and if there is putrefaction present, it may not be found in the body. Coming to circumstance poisoning, accidental poisoning usually occurs due to eating the roots mistaken for horseradish, and mainly used who are used the quacks remedies containing it, or taken from liquor to which aconitine is added to increase the intoxication. So, it may occur by cause of cooking or by quacks or by if it is mixed with the alcohol, the accidental poison occurs. Suicidal cases often occur. It is given with bitter leaf to conceal its taste for homicidal purposes. It is also given. Root is used as a abortifacient. It is also used as a kettle poison and also as arrow poison because of its sweetish taste. These are my references. Thank you.